Good afternoon, everyone. Thank you for joining us for this live session. Today is the 5th of October, and as we all know, October is Breast Cancer Awareness Month, and there have been a lot of talks about various aspects of breast cancer. Firstly, I'd like to introduce myself. My name is Dr. Rita Dabur. I am a breast surgeon and general surgeon working at Medcare Women and Children Hospital. About 2 years ago, I came out to the United Arab Emirates, having practiced previously for the last 15 years as a breast surgeon and general surgeon in Sydney, Australia. So I would like to welcome you again to this session. We decided that we would talk about what to do when we find a breast lump. Now, before that, I would like to explain the differences between, screening breasts and actually finding a lump. So when we do screening, we're actually testing for, examining breasts through imaging without actually feeling any lumps at all. Whereas when we actually find a lump, we are starting off having found a lump and then going on to look at this lump further with imaging, whether it be x-rays or ultrasounds. It is about awareness, and early awareness and early detection is the key, as everyone else has been saying all along. And my first message is, God forbid, if you were to find a lump in the breasts, don't panic. I cannot say that enough. Do not panic. Simply do plan to see a doctor at some stage for further assessment. Now, before we actually end up seeing a doctor, of course, sometimes 2-3 days or even a week can pass by, and in that period of time, we can certainly assess ourselves to get further information about what the likelihood is of this being, potentially being a cancer or not. Now, when I say don't panic, I say that because, most breast lumps are not, thankfully, they are not cancerous, they are benign. And especially breast lumps in those women who are under 40 years of age, let's say, or even under 30 years of age, the great proportion of breast lumps that are found are actually benign. Having said that, that does not mean that we are allowed not to test ourselves if we do find a lump, because without getting the formal assessment, we won't really know which ones are cancerous and which ones are not. So in order to find a breast lump, first of all, we would recommend that every woman should learn to examine her own breasts regularly. And most women will say, well, how do I know if this is a lump or not? How do I know what I'm looking for? And the message is practice. Okay, so I'm just going to pretend, for example, that my mask is a breast. And we tend to treat the breast as if it's a sphere, okay, or a clock face. And starting at 12 o'clock, we would go around the breast in a circular fashion, sometimes even using this circular motion to be able to find a lump. Okay, we go all around, and then the last bit is actually the nipple in the middle. And the idea is if we press the breast down on the muscle at the back, then we might be able to feel a lump. Now, a lot of women will go through stages just before their period when they get breast pain. It's called cyclical breast pain. It can happen a couple of days before the period, and the breasts get lumpy. Now, if we learn to examine our breasts, we would learn that this is normal. So we can start anytime, but the recommended time to examine your breasts is actually after the period. And that is because there's no pain after your period, and it's a lot less lumpy and soft. So it's recommended that every woman should examine her breast once every 2 months. And it is best to examine the breast at first standing up, but if there's anything of concern, the better way to examine the breast, of course, is lying down, and because it is easier to detect lumps that way. So if we learn to examine our breast, then God forbid if something new came up, then such as a new lump, then we will know this is new, and that means we need to attend to the doctor for a checkup. Now, so a few things that we as doctors look for, we would like to educate the general public about what we look for to try and determine if this is possibly benign or not. So if the lump is hard, for example, it can mean it could be of concern, but not necessarily. So one other thing we look for is whether it is mobile. If this lump is slippery, like a marble, it can slip around in the breast when we press on it, that is more likely that it's benign and not cancerous. If it is star-shaped or fixed and does not move around, it is more likely to be of concern. The other major thing is that if this lump is painful, and would you believe most women don't realize that if a lump is painful, it's actually a good sign. It's actually reassuring when we press on a lump and it's painful, then most likely this is not cancer. It is either an infection or hormonal pain, and we tend to relax if that's the case. So it is really important to look out for the hard lump that is not painful, that is not mobile, and that can actually grow in a short period of time and change in a short period of time. Now, having said that again, we do have time for, let's say, up to a week, 10 days to recheck this lump if we do find one. For example, if we can wait for the period to come, if it's within that time period, and recheck the lump again. So if the lump is softer, we can relax. Of course, we still have to get the proper checkups. Sometimes these lumps go away, and that's a good sign as well. But if the lump is persistently there, or if it is changing, increasing in size, then we do need to attend to the doctor as soon as practical and as soon as possible to get it checked properly. Now, what do we do as doctors when we examine a breast lump, let's say? And it's not just a breast lump, even anything new that when we talk about a new change, any change in the skin of the breast, any change in the nipple, any new nipple discharge, all of these things have to be checked from scratch by a doctor. So we examine the breast, we check for these things, whether it's painful, how hard it is, how mobile it is, what size is it. We also tend to check the area of the underarms, and that's where the lymphatic nodes occur. Again, if we feel lumps under the arms that are hard, not mobile, again, that can point towards a possible problem. Now, we as doctors ourselves don't just rely on the hand examination, although the examination by hand does give us a reasonable idea of what is going on. We still need to look further with investigations such as mammogram, ultrasound, or MRI. Now, there is an age cutoff for mammograms. It is preferable to do mammograms, which are actually x-rays of the breast, once we are over 40, and there's a reason for that, which is, breasts under 40 years of age are too dense, they are too firm, and the x-ray of the mammogram does not really see through them very well. So this is why it is recommended to start having mammograms from 40 years and above. Now, if we do find a lump, we can do a mammogram. It doesn't mean we can't under 40, but we tend to restrict it to those over 40. Under 40, we utilize ultrasounds and MRIs much more than mammograms, and in those who are over 40, we can make use of all three: ultrasound, mammogram, or MRI. So if based on the examination by hand and the look on the ultrasound or mammogram or both, there are distinct lumps that can look quite benign. Not all of them need to be biopsied even, and not all of them need to be removed. There are criteria which ones would need to be removed or biopsied. Having said that, if there is a suspicious lump, or what we call suspicious is something that looks like potentially problematic, and sometimes it doesn't even have to be suspicious, it can just look a little bit different and it doesn't fit the criteria of a truly benign lump. If we're just not sure, we prefer to go ahead and have a biopsy. Most biopsies are performed under ultrasound guidance. However, there are some biopsies that can be done under mammographic guidance, for example. And based on the biopsy results, we can then make decisions about the next step of management. So I just wanted to say that, again, my message is please check yourselves, learn to check your own breasts. If there's any change, please attend to see the doctor. Do not panic. I mean, even breast cancer itself, early detection can mean a cure, and this is what it's all about, early presentation. And again, most lumps, we're talking probably 80% or more of lumps in breasts, especially under 40 years of age, they are actually benign. So don't be afraid to attend for a checkup, and don't panic in that time that you are waiting for the checkup. Assume that it's all going to be for the COVID.
Yes. First of all, Doctor, thank you for joining us for this such an important topic. Like you rightly mentioned, October is the month of breast cancer awareness. We do have a few questions that people would like to know about, or more about this topic, so to say. When do you suppose lumps can be dangerous? I mean, like you said, there are a few lumps that are benign, and then there are a few lumps that are cancerous. Do these benign lumps somehow develop into cancerous? Is that a possibility?
So the most common benign lump in the breast is a lump called the fibroadenoma.
Okay.
And they constitute about 80% of lumps, let's say, for those under 40. Those do not turn into cancer. They're not cancerous, they don't turn into cancer, but they can grow. So they still need a proper assessment, and they do need to be followed up properly.
Okay.
And sometimes they need to be removed. So if they grow, and they certainly can grow to quite a large size sometimes, they need to be removed. In general, any lump that grows anywhere in the body, whether it be in the breast or anywhere else, it really has to be removed for proper assessment. Okay. Now, there are other lumps that can look similar to these fibroadenomas, and if they look a little bit strange and behave a little bit strangely, they would need biopsies. So in general, fibroadenomas, we don't always have to biopsy them. We can sometimes just remove them if they're growing. But having said that, occasionally there are other types of lumps that can look similar, but they need to be biopsied and treated differently.
So once they've come in and they've got the lump removed, can they reappear? Can these lumps reappear?
So the fibroadenomas, usually they don't if they have been removed completely, and it's very easy to remove them completely because they have a nice round capsule. However, rarely they can grow back very slowly if part of them was left there. But again, having said that, even if they grow back, they're still benign. But they hardly even, they hardly ever grow back.
Yeah. Really. So these benign lumps cannot, there are less chances of them becoming cancerous.
Correct. They don't really turn into cancers.
Okay. You spoke about physical examination. Can we just have, what is the importance of physical examination? Because you said maybe not all lumps can be detected, and maybe there are some lumps. So what is the importance, and how often should one be doing this physical examination on themselves?
Yes. So we spoke right at the beginning about the difference between screening tests and actually going ahead and finding a lump and then doing the tests. So it is important to do the screening tests because not all we can't feel all lumps. A lump has to hit a certain size before we start to be able to feel it. And they say the minimum size we can feel by hand is 1 centimeter. Now 1 centimeter is quite a reasonable size for it to get. When we do screening, and that's where screening can come in and pick it up even earlier with ultrasounds or mammograms, we can pick them up much smaller than when they've had a chance to be picked up by hand. So a certain proportion of cancers that are diagnosed, that they are actually picked up by the women themselves from self-examinations, but usually by then. By the time you feel a lump, it's at least 1 centimeter in size. So just to let you know, ultrasounds and mammograms pick up different. They're good at different things. The ultrasound is good at picking up a very, very early lump, even from 3 or 4 millimeters in size. But it won't pick up something that has not become a lump yet. Whereas a mammogram, an X-ray, can pick up changes in the breast that have not even become a lump yet. And it can pick up changes that could potentially become cancerous 8 years down the track.
Oh, okay.
or up to 8 years down the track. So both of this is why we say we utilize both of them together, because each one gives us its own, it's better at some things, and together it gives us a better chance of making sure there's nothing there.
So when you detect a lump, do you recommend for the patients to do a mammogram and an ultrasound, or
Usually both, yes.
Usually
yes,
both.
because again it gives us added information. So the mammogram will give us information about what's around the lump and what the lump itself looks like.
Okay.
The ultrasound is the same. It can tell us about the lump. It can tell us about other lumps that could be on the same side,
Okay.
as well as the other side.
Oh, they can. And how early can a woman or a girl start ultrasound? What age is?
So ultrasounds are completely radiation free, which means if we have an ultrasound every day, there is no harm from ultrasounds. This is the good thing about the ultrasounds.
Okay.
So we can start ultrasounds anytime. As soon as breasts develop, some young ladies can get breast lumps at 15 years of age.
Oh,
They're
really?
benign, usually benign
Yeah,
lumps.
okay.
So they can start having ultrasounds to assess lumps without any harm whatsoever.
Okay.
Now, mammograms, which are X-rays, do have radiation involved, but that's why they're only recommended from 40 years of age, and usually every 2 years for most of the population.
So is it because of the radiation that we tell to do it after the age of 40, or is it because they're generally dense?
It's usually because of the density of the breast.
Okay.
But the reason we space them out is because of the radiation exposure, and also because of how it behaves. So usually these changes that come up don't come up suddenly. They don't usually come up in months, but more in years.
Okay.
But again, having said that, those women who have a strong family history of breast cancer, usually they're recommended to have yearly mammograms.
Okay.
There's a risk versus benefit. Okay, so the higher risk that you have of potentially getting breast cancer, then we worry less about the radiation effect, which is sort of risk down there.
You just analyze, it's the risk analysis. So
risk, risk versus benefit.
Okay. So how early, for example, if a lady has a family history of breast cancer, how early should she, do you recommend that she can go in for a mammogram?
Okay, so again, we try not to utilize mammograms under 40 because, like we said, it's not as helpful in those under 40.
Okay.
We do tend to rely more on MRIs in women who are under 40 with a high risk of breast cancer.
Okay.
So if there's breast cancer in the family, not only do we do ultrasounds, but we also do MRIs. In general, 30 and above.
30 and
above. But the general rule is that you're supposed to test 10 years younger than the youngest member in the family who had breast cancer. So if the youngest member was 40 when they had breast cancer, we should be testing from 30 years of age.
Oh, really? Okay. So, I mean...
10 years before it's had a chance to develop.
Other than mammogram and ultrasound, is there any other way to find out if you've got cancer? I mean, once these tests are done, what kind of other tests are required?
So from the imaging point of view, radiology or X-rays, so we've got the ultrasound, the mammogram, and the MRI. All three can be used, and each has its own. Each is good as it's got its own niche. So all three together, and added, of course, the physical examination as well gives us information as well, and added to that tissue biopsy, pathology. So obtaining a bit of tissue to sample what it is exactly under the microscope. Now, there's a question that I get asked a lot from patients, and that is, does performing a biopsy on a lump, if it's cancer, does it make it worse? And the answer is, in breast cancer, no, it does not. You can biopsy a lump as much as possible, even if it is cancerous, and it will not make it it will not make it spread. Now, there are other types of cancers that can happen. I think that's where the myth has come from. But in breast cancer, it is very safe to perform needle biopsies without any harm whatsoever.
Without this thing?
Yeah, without any spread or harm.
Okay, so then that's good then. I mean, I think since you said that was one of the most questioned, I'm sure audience would have benefited from it.
Yes.
One other thing that do you see these cases happening a lot more? Do you see a lot of young girls coming in with a lump, with the experience that you carry? Do you think it's more common?
Well, with the population explosion, and also with we're living longer. So, of course, the incidence of breast cancer is increasing, sadly. But I just again want to say that breast cancer is the most widely and intensely researched out of all the cancers.
Correct, yes.
So this is how we have so many treatments available for breast cancer. So when we compare breast cancer to other types of cancers, it's actually a lot of the time much better than other cancers in that we have treatments available. And this is where we talk about there is a life for most women after a diagnosis of breast cancer. And this is why we shouldn't fear it, we should face it.
We should face it, and early we face it, the better it is.
Exactly right.
Does breast cancer, so for example, if a woman has breast cancer, can her offsprings get any other cancer other than breast cancer? Is that a possibility?
Yes, it's possible. So there are families that do have genetic tests, for example. They do have not just a high incidence of breast cancer or ovarian cancer, and incidentally, breast cancer and ovarian cancer are actually related. So when I ask for somebody's past family history, I ask about breast cancer and ovarian cancer because they're both related. Now, we don't know all the genes that are involved. We do know the ones involved with breast cancer, but not all of them. Now, there are families that have multiple cancers. For example, they'll have an uncle who had stomach cancer, another one who had different type of cancer, and they can be related. So if we have a family that has a lot of cancers in it, or certain types of cancers, then we would treat them as high risk as well.
You will treat them as high risk.
Correct.
Do you come across with a lot of women who are scared of, once they found a lump, they're actually scared of going and getting a mammogram and an ultrasound?
Yes.
Do you come up with...
So a lot of women attend the clinic, they are really, really worried. Or let's say they found a lump, and that's why I said do not panic. The problem is that it does take time to get into the clinic sometimes, even overnight, right? And by the time they attend the clinic, they are almost having a nervous breakdown. Oh, I found a lump, and what's going to happen? They're already thinking, preparing bad things around the corner. And I usually tell them, a lot of the time we do the test and there's nothing that's benign. It looks benign. I try and reassure them, even just based on the feel. And so I tell them, not to panic. And the other thing is, wait for the test results. Like, I know it's easier said than done, but sometimes you don't want to be, God forbid, having a heart attack while waiting for a benign test result.
Yes, of course. What do you tell these women? I mean, how do you encourage? What can we tell them to make sure that they walk into the? We all know the earlier it's detected, the better it is.
Correct.
But for some reason, women yet get scared.
Yes. I usually try and tell them to, relax, we've got to remind ourselves that, look, most likely this is going to be benign. Yes, we have to go through the tests and we should not neglect going through the tests. But I usually tell them, look, this is your homework. You have homework to do. You have to have an ultrasound, a mammogram. Let's get you back and look at it. But between now and then, don't dwell on it too much. Don't think about it too much. Go through the motions, make the appointment, attend, but try and keep occupied with other things in between.
And do you recommend any kind of diet to them? Any nutrition, advice that you can probably give to these women who have detected a lump and, probably scared or carry a family history?
Yes. So I would recommend a normal healthy diet which boosts the immune system. The immune system is really a strong part of preventing cancer in the first place, or even fighting cancer, or even surviving from cancer. So those who have a stronger immune system do better after cancer treatment. So I tell them to stay healthy, go for walks, exercise 3 times a week, go and do some dancing. I know now with COVID that's a little bit limited, but try and be as positive as possible. And even those who do have the diagnosis, like I said, there is a life after, even with a cancer diagnosis, there is a life after that. I tell them that you are allowed to get sad about what's happening, but don't stay down in the trough. You're allowed to spend a few hours saying what's happening, I have to go through this and that, but don't stay down there. Get back up and get back into life and fight it. It's just a fight that will go, we have to go through the treatment. It's like being in the ring and fighting it, and then we've got to win.
Because obviously you can fight it. You can. There's always a chance. One of the last questions. So now when a woman comes in for a mammogram or for an ultrasound, how quickly do these women get their test results?
Pretty quickly, actually, especially at Medcare Women and Children Hospital, we have really, really excellent female specialists. We have 3 of them. They're all very good. And once you actually get the picture of the ultrasound or the mammogram on the spot, you can get an idea what this, most of the time,
Okay.
not 100% of the time, but we're talking more than 90% of the time, you
Okay.
get an idea just from the picture.
Okay.
By the time the reports get typed up and dictated, typed up, we're talking within the hour sometimes. We've got a result. Yes,
okay.
yes.
That's good.
So
then.
it's excellent service.
And
yes.
so then the treatment can start
pretty soon.
Yeah,
after.
pretty soon as well. Anyways, thank you so much, Doctor, for joining us for this very important session, and in the month of October. Thank you so much, and I'm sure our viewers would have really benefited from the session.
And thank you very much for having me here. And again, I would encourage all women that if I can be of help at Medcare Women and Children Hospital, Dr. Rita Dabul, I'm there at your service with the hospital and the other specialists as well. Thanks again.